It's Charles Barkley with Wayfair. It's outdoor season, and my patio setup better be ready to play. That's where Wayfair wins. Patio seating, umbrellas, and grills, all delivered fast and easy. Shop wayfair.ca now.
Wayfair, every style, every home.
Let's turn our attention now to Rouyn-Noranda. And, we've heard these stories of the copper smelter out there and the risk of cancer from arsenic exposure. Boy, it's very, very interesting here, right? In public health, Luc Boileau was having a press conference this morning on COVID. Yesterday, he was having a press conference on this subject, right? Last year, the smelter reported an average annual concentration of arsenic of 87 nanograms per cubic meter. But of course, none of us know what 87 nanograms per cubic meter actually means. But I can tell you that it's nearly 30 times more than the level that the Quebec Environment Ministry considers safe. But by the way, new report shows that even if they lowered it, significant health risks would remain. So let's talk about those health risks, right? I think we all should be concerned about stuff that is in our air, not just if you live right next to a smelter. Let's go to Dr. Nicole Ezer, respirologist at the MUHC and a researcher in the Translational Research in Respiratory Diseases program. Dr. Ezer, welcome to the show.
Thank you for having me.
So what's, when you see the coverage and you hear the story out of Rouyn-Noranda and the levels of arsenic out there, when you hear that, what goes through your mind?
I worry about the risk of lung cancer in that population, and I think the press conference from Dr. Boileau reflected the same thing, is that it's a known carcinogen, it's associated with higher rates of lung cancer amongst other diseases, and that's very concerning given how poor the outcomes for lung cancer are.
And, what are the risks? Like, just how much higher is it, and what are residents at risk of?
So the risk is not just based on the exposure of that day. It's really based on cumulative exposure over a lifetime. That smelter between 1991 and 2005 had very high, even higher than now. They had very high arsenic levels measured in the air in that time. It's gone down since 2005. It's still very high. But people who've lived there in that period have had that exposure for that period of time. So in those people, the risk is already, the damage may already be done in terms of increasing their risk. And what happens is you become at a higher risk of lung cancer. It sort of has an impact on the genes in your lungs that are responsible for surveilling your mutations, and it can increase your risk of lung cancer.
And is there ever any sort of acceptable level of arsenic or anything else that that comes out of a smelter?
Well, I think that we have limits that are published by the WHO and Health Canada that we know are safe, and that's, below 3. If the risk is slightly increased, if it goes to 4, that's one thing. But we're talking about, an excess number of lung cancer diagnoses depending on what data you read in that population, between 1 and 14 more people over that period of 70 years would have lung cancer, more than the baseline of 550. So we're looking at, a significant, it seems like a small number, but it's a small population. There's not 1 million people living in Rouyn-Noranda, but that's a significantly increased risk from the baseline of our population in Quebec.
So can I ask if there's anything, resident could do? If you knew you live near risk, is there anything you could do to mitigate those risks?
So we know that there's an additive risk if you smoke. So the number one thing would be to stop smoking, because that's an added insult to your lungs and would increase your lung cancer risk. So that's a no-brainer. There are lung cancer screening programs that are available for smokers and ex-smokers. So if people are between the ages of 55 and 74, they can call the Quebec Lung Cancer Screening Program without even a referral to be screened if they meet the criteria. But the most important thing that they can do is really quit smoking, because that has the biggest impact on reducing their risk of lung cancer.
So let me ask you this: if I live in Montreal and I'm a smoker, or I'm in Rouyn-Noranda and I live as close as possible to this smelter, who's at a higher risk of lung cancer?
Well, the guy in Rouen is probably at a higher risk, but it doesn't mean that, if you're in Montreal and you smoke and, you're between 55 and 75 and you have kind of a significant smoking history, so more than a pack a day for 20 years, you could be screened. But the guy in Rouen has a higher risk of lung cancer, that's for sure.
Are there other types of industry that also contribute to lung cancer and other respiratory ailments that, let's say people in Montreal and the surrounding area have to deal with?
Well, we know that, there's pollutants that are associated with higher risks of lung cancer, and those are significant. The smelter also has other elements that are released, like cadmium and nickel, that are known carcinogen as well. The other thing is in the soil, there's what's called radon that comes from the soil. So radon is a known association with higher lung cancer risk, and that's really based on the geographic composition of the soil. So there's certain areas in Quebec that have higher radon levels. So those are known risk factors for lung cancer. There's also kind of a genetic predisposition. So some ethnicities have higher lung cancer rates. So and some families have higher lung cancer rates. So those are all known risk factors.
We're wrapping up here with Dr. Nicole Ezer, respirologist at the MUHC, and we're talking about arsenic levels as of due to that story out of Rouyn-Noranda with the copper smelter there, which has many, many people concerned. Let me ask you, Dr. Ezer, as we're wrapping up here on this one. Arsenic in Montreal, is that an issue here?
Not that I'm aware of. There's not known to be significant high levels in the air of arsenic in Montreal. At least not that I'm aware of.
And is there anything that I'm missing out on here? Is there anything else that you particularly wanted to talk about when we're talking about arsenic and whether it's smelters or other industry that I may have not touched upon?
No, but I think that our public health system and our government has the responsibility to the population in Rouen to really, protect them from environmental risk associated with private industry. So I hope that there's some consequences of this report for the population of Rouen.
And do you think the various levels of government are doing their job here?
I think that we will see. There's some recommendations that we're waiting to hear and some suggestions on what the next steps are that we are anxiously awaiting. And I think the representatives in that area are also awaiting them. So we will see.
Dr. Ezer, thank you so much for your time this morning.
Thank you.
That is Dr. Nicole Ezer, respirologist at the MUHC.